Director Reese, you're on mute.
So now I'll try that one more time. Good afternoon, everyone. This is Andy Reese, Director of the Department on Disability Services. I will start, as always, with our data. We did have one more person test positive for coronavirus this week. So our total at this point is 440 people who have tested positive for COVID-19. That number doesn't sound right to me. So by placement type, there have been 9 in host homes, 114 in intermediate care facilities, 1 in a mental health facility, 59 in natural homes, which is where the person this week was, 2 in a nursing home, 4 in out-of-state placements, 40 in residential habilitation, and 211 in supported living. So the 6 people that were added in September, of those people, 4 had been vaccinated and 2 were not vaccinated. The 2 not vaccinated were both people in natural homes. And so to date, by placement type, the 114 people in ICFs reflect about 38% of people in ICFs who have contracted COVID-19. Of those 114 people, we have had 28 deaths. However, 13 of those deaths were determined to be caused by COVID-19. So that reflects about 11.5% of people in ICFs who contracted COVID who went on to have a confirmed COVID cause of death. In natural homes, that total reflects about 6.3% of people in natural homes. And of those people in natural homes, there have been 5 deaths. All were confirmed as COVID related, reflecting about 8.5% of people who contracted COVID who were in natural homes who died from COVID. In residential habilitation, the 40 people who contracted COVID reflect about 36% of people in residential habilitation placements. Of those, 3 have died. 2 were confirmed COVID deaths, which reflects a 5% of people in ResHab who contracted COVID who then had a confirmed COVID death. In supported living, 211 people who contracted COVID represent about 23% of people in supported living. Of those, we have had 22 deaths, although 15 are confirmed as COVID related, representing about 7%. So overall in DDA, the 440 people represent about 18% of people supported by DDA. Of those, there have been 61 deaths, although just 37 of those are confirmed as COVID related, representing a little over 8% of people who contracted COVID and went on to have a COVID related death. So in the month of September, by placement type, we have had 6 people, as I said. 3 were in natural homes, 2 in supported living, and 1 in residential habilitation. None of those people have required inpatient treatment. Most of them, I don't know the number off the top of my head, most have been were people who were tested because of an exposure and have been asymptomatic. The others have been symptomatic but have been treated at home. People with COVID who have died, there have been no deaths in September thus far. There was one in August. And of those confirmed COVID deaths, the last that we had was in March, and there were 2 confirmed COVID deaths in March. Provider staff diagnosed with COVID, there were 5 additional people this week. So that's up to 725 at this point. 10 staff have died from COVID. 52 of the 725 people who contracted COVID worked at more than one agency. Or I should say were reported by more than one agency. So vaccination rates to date amongst people supported by DDA, we're at 78%. In host homes, it's at 82%. In intermediate care facilities, it's at 98%. Natural homes is at 62%. Residential habilitation at 96%, and supported living is at 85%. Providers staff, updated as of yesterday, was just at 69%. I'm hopeful that some of it is that we didn't get all the updates because that's quite a heavy lift between now and the end of the month for an additional 31% of folks. Among DDS staff, as of now, we are at 84% of our staff. As people may be aware, by next Monday, all of our staff are required to be tested or meet one of 3 waivers, which would be religious exemption, a health exemption, or that they begin testing weekly. So I know that we received 2 questions and I don't have them in front of me. If someone can put them in the chat, we can respond to those. Just as a reminder, if people have questions, those can be put, please address them to everyone in the chat. We do have our regular folks here from DC Health. Andrea Coker is with us. That's actually, I thought I saw Nelson before. Yep, and Nelson Benucci is with us. And Charlene Wills let us know that she is on her way to a phone or a computer so that she will be available to respond to questions. She's not here yet, but she will be here. Just as an update regarding vaccination incentives in Arpa, as we've explained before, the Arpa, which provided additional funds for waivers, we included in our plan, which was approved 2 or 3 weeks ago at this point, incentives for employees to get vaccinated, and that went across several different employee types, and so we've had to coordinate across a number of agencies. And what will be happening very soon is that a request for application will be posted on DHCF's website, which will look very much like the plan that is in the Arpa plan, which provides for our provider agencies to have a plan for incentives that would then be reimbursed. The reimbursement rate, which would be for waiver providers only, waiver providers only, would be $120 per eligible employee. And the plan for how those funds are spent would be included in the response to the request for application. And then to the extent that plan is approved, it would also include how the documentation is gathered, and the agency would then be reimbursed. How is DC Health expecting providers to verify that employees have completed their vaccine attestation? Is it acceptable for us to have a compiled list as a provider that notes when each employee entered their information? Will DC, oh, this is a number of questions. Will DC Health be doing random audits to determine if people have submitted their information? What would be the consequence to the provider if an employee had not submitted their attestation? So we spoke about this last week, that a notice went out to all, well, we thought to all providers. And when there was some question about that, we then sent it out again last week that provided a link so that providers, so that individuals could enter their information. I walked through that today. I didn't hit submit, so I don't know that it worked. But if a person in completing that information puts their name and says yes, they've been vaccinated, it then there's a place there that requires that person to upload a document proving that they've been vaccinated. If they say no, then it gives them options about exemptions. And based on what they click there, they can upload a document that supports their exemption request. Exemptions have to be approved by DC Health. And I don't know, Ms. Wills is from the general counsel's office at DC Health. So when she gets here, we can ask if she has an answer to some of these questions. Because I don't know the answer to how DC Health will be enforcing those vaccine requirements, except that for people who are licensed professionals, the regulation does give them pretty clear guidance that, of when they have to have a first shot by, and that in order to renew a license, a person has to demonstrate that they're fully vaccinated. And so if a person submits a license renewal request and they have not uploaded documentation that they're fully vaccinated, I expect their license would not be renewed. Beyond that, the question regarding, I guess, the surveys that are done for ICFs that are monitored by DC Health would be a question for the folks in, and I don't know if there is someone here from DC Health that can answer that, for folks who are waiver providers. As I said last week, we will be, and I do see Charlene is here, so I'll let her answer all those questions in that one question. We will be including the requirement that people become vaccinated along with other qualifications that are required for staff in the regular reviews that are currently done. So, Ms. Wills, if you have anything else to add in response, I don't know if you heard this multi-part question.
I did not hear the multi-part question. Someone just was in my office. So would you mind repeating it for me? I'm sorry.
Not at all. How is DC Health expecting providers to verify that employees have completed their vaccine attestation? I don't know that DC Health is expecting providers to verify that employees have submitted something to DC Health.
Correct. So I'm trying to figure out what the context of the question is. If the question is, this particular person is, there's two types of persons they may be referring to. One is a licensed health occupation professional, and one is the unlicensed health occupation professional. If you're referring to the licensed health professional and they have not, that person would receive notification that they're not in compliance with it. it's under the same, but so that individual is in charge of informing their provider or employer that they are not in compliance with the regulation. And I'm kind of confused how the provider in that scenario, unless you're referring to that the provider has a responsibility to ensure that this person is in compliance.
That would be it.
Right. So I guess that's the question, like how the provider, the way these regs are have been written is that the provider comes up with their own policies to determine whether or not you're in compliance. So if they have a form that says, I have submitted this to DC Health, I'm pending exemption, I don't have to do this in order to keep my license. At that point, it becomes similar to any other requirement of your licensure. So if your employment is predicated upon you having a valid license and you've done something that is not in compliance with the license under the regs, what is the procedure for the provider to ensure that someone has a valid license and in good standing?
And so I think probably part of the confusion is that the DC Health portal that's there is for individuals to enter their information, not for the provider
Correct.
to go in and enter it for them.
Correct.
And
So
I
that's
guess,
why I'm kind of,
right. So I was just thinking, so like for a person who works in 3 different places, they're probably going to have to produce their documentation 4 times for DC Health and then for each of their employers. Because as an employer, I expect you'll be wanting to make sure your staff are vaccinated.
correct. And that might be, that's separate and apart from, so you have a provider who is not DC government, and they have their own internal policy on vaccinations and what their employee has to submit. The DC government has regulations for employees of DC as well as health professionals who are licensed and unlicensed. I'm going to get to the second question about how would you know people who aren't licensed. That falls on the provider there. But in terms of persons who are licensed, they have to submit their proof on the dashboard. Providers are not able to have access to the dashboard to see whether or not this person has done it. Yes, someone who works for several different providers or one will have to submit whatever the policy is to their provider, the same information. For example, if it was me, I would have to submit the same documentation or attestation to one person, to whoever it is. So it is that. I'm not sure. It sounds more convoluted than it has to be, but it's the regulation of your license. It's just another control of the regulation of your license of providing, similar to if the provider has certain requirements for employment that may be parallel to the requirements of your health occupation license. Just because they're parallel does not necessarily mean they're duplicative. They have 2 different requirements. One is the provider's requirements, and one is DC government's requirements under DC Health regulatory authority. I think so. I hope that people understand that the provider creates their own policy or mechanism, as long as it's compliant and works with the law, the current regulations, to get a copy of what their licensee or the employee submits to DC government, however they want to do it. If they want to have a attestation, if they want to have actual proof of it, however they want to comply. I think the other question is someone who is in a health occupation who is unlicensed. The question that I'm reading here is whether or not DC Health is going to be doing random audits of waiver providers to ensure that they're in compliance with the reg. So that is like a multi-part question. If you are identified as someone who is not licensed in the healthcare occupation, but pursuant to the regs, you must either, you're mandated to have a vaccination or submit a exemption provided under the regs. Whether DC Health is going to do an audit of the providers to ensure that the waivers that they provided are in compliance with the regulations. The waivers, if you're unlicensed healthcare provider and you're mandated under the regulations to be vaccinated, there in the dashboard, you're supposed to submit that information to DC Health. And you will say, there is a, for lack of a better word, a drop-down menu, you're unlicensed. In that drop-down menu, you will state whether or not you're vaccinated or you're seeking a waiver. The waiver does not, my understanding, the waiver does not come from the provider. The waiver is from DC Health. So if someone is seeking a waiver pursuant to this regulation, they must seek it from DC Health, not from their provider. Yes. So this is the big question, Robin. Unlicensed professionals and licensed professionals, while they submit a fully completed exemption request and it's under review, are allowed to work.
We just lost you, Charlie.
No, that was the end of the question. You're allowed to work. That was why I was seeing if anybody had a follow-up, because I'm about to read off some other answers, and bear with me one more second.
So this one question related to enforcement is, what is the consequence to a provider if an employee is not, they're saying has not submitted their attestation, but the reality is, what's the consequence to a provider if an employee is not vaccinated or has an appropriate exemption?
Okay. The regulations do not provide, if you are seeking an exemption under the healthcare occupation mandate, to undergo testing. If your provider, however, if the provider mandates that you have to undergo weekly testing until the exemption decision has been provided, then you may, that's for the provider. But DC Health is not making a mandate that you undergo testing while you're waiting for exemption. I'm going to go back to Ian's point. I'm sorry. Will there be some written instructions on the submission process on everything that was just said? So written instructions on the submission process. If you don't mind, Ian, would you provide to me what, so I'm going to go through it really slowly, is I'm sorry, you will first go to the dashboard at DC Health link. If you are one of the persons that is covered by the regulation, you would go there. There's a drop-down menu. You would submit whether or not you're licensed, and if you are a licensed healthcare provider, what is your license under? Provide your name, your occupation, where do you work, and the reason for the exemption. After you provide that, it's submitted. It's very straightforward. Now, I think I was talking about I was referring to, yes, I would provide you with a dashboard for exemptions, yes. What I was referring to was the first part, and I don't know, did I answer that part clearly enough? Where to go? Just want to make sure that you understand. You go to the link, and that's how you will first request your exemption. Then the earlier question was, is DC Health going to perform random audits of waiver providers? And I interpreted that question to mean that that person, the questioner, was interpreting the regs to mean that the provider is going to review the waiver request. If you are submitting a waiver request under the regulation, the provider does not provide that. DC Health provides the waiver request reviews. So that's what I was talking about, that process. Going to the dashboard, waiver request, go to DC Health. When you're doing things compliant to DC Health regulations in this circumstance. Now, my voice keeps dropping. I'm sorry. Let me see if I can drop this. I can. I will provide it in writing, but this first step is going to the dashboard, entering your information, and submitting a request. The providers do not review or make a determination on your waiver request. Absolutely, I do think it will be helpful in writing. Okay, I agree with you.
Can I just let you know, Charlene, about half of the people on this call are on their phone and they don't have access to the chat. So people who have access to the chat know exactly what you're responding to, but people on their phone don't. So anytime you're responding to a question, can you read the question that you're responding to first?
Yes, thank you. That's very helpful.
On the phone up to speed. I found that out when I was listening in on the phone a couple weeks.
Absolutely. So let me take this back to a second.
Let me just clarify two things that I can answer here directly and quickly.
Thank you.
People have asked again about the portal you're referring to, the letter that went out from DC Health. I'm sure they thought to all providers, we provided them the list. So the letter that went out from them more than a week ago and then went out from us within the past week provides a link within the letter for the person to be able to go in and enter their vaccine information. That's how you get access to what Charlene is referring to here. There was also a question here about the vaccine incentive, and the effective date will go back to, I don't know the exact date, but it's like some date in the middle of December when vaccines first became available. And so for providers that provided incentives earlier on, when you get your request when you see the request for application, you'll just submit a response to that indicates here are the things we did or are planning to do, and can get reimbursed based on that, going all the way back to December of 2020.
Thank you. So going back to what you just said, Director Reese, is it appropriate for me to say at this time that if someone needs that notice, that you will be able to make sure someone gets a copy of the notice, because that's where the information about the dashboard or the portal is, and it should walk you through the step-by-step for those who couldn't hear what I was saying and that I was given a background without the proper context.
Any provider who has not received that should contact their quality resource specialist and they will send it to them.
Thank you very much, Director Reese. I'm going to go back up. Are unlicensed professionals allowed to work while an exemption is under review by DC Health? What about licensed professionals? I believe I answered this, but I really do want to stress this. Once you have submitted a request for a waiver of the vaccination mandate, While it is under review, licensed and unlicensed professionals may continue to work while the exemption request is under review by DC Health. You do not have to, the question here is, do they have to undergo testing, meaning the person who made the request while it's under review, while they are waiting for an exemption decision? The DC Health regulations are not asking at this time, nor is DC Health going to request that someone undergo testing while they're waiting for an exemption decision. However, individual providers may require that someone who is asking for a waiver may undergo testing. That is not DC Health's mandate at this time. I
That
have
does
a
not
question,
mean
will there
that
be
individual providers could not require that on their own, even after the exemption has been granted. Decisions regarding testing of your employees are decisions that providers can make on their own.
That is correct. I want to stress that DC Health, while may not be requiring testing while waiting for the decision on an exemption, or after, if an exemption has been provided, the provider, and that is a part of the regs, the provider may require testing during the waiting period and testing if an exemption has been granted. Ian, I do have your question. Will there be some written instructions on the submission process on everything that was just said? As Director Reese has provided, there has been. If you need to seek it, I believe Director Reese was very clear on where you may find the written instruction. I have a question. If an exemption is granted, are healthcare workers required to continue testing to be allowed to work? I think we just answered that question. DC Health is not requiring, pursuant to the regulations, that a healthcare worker is required to continue to testing to be allowed to work if an exemption is granted. However, the provider may require such an exemption, such a testing to be allowed to work. So that was asked twice. Director Reese answered the question, is vaccination incentive applicable to staff who have vaccinated earlier? How will the link capture unlicensed staff data? My understanding in the dashboard, as I stated earlier, there is a drop-down menu to indicate whether or not you are unvaxxed, if you are unlicensed health occupation professional. It does require that the regulation will require that if you work in the healthcare field, you will have to identify yourself as one who must have either received the vaccination or you have received an approved waiver. It's self-identified. However, the provider knows who are their employees who are covered under this mandate, and they will probably identify you as well. If you have questions or if individuals have questions, I'm not sure if I'm someone who is covered by this mandate, I do suggest you seek the provider to find out further, are you that person who has to be covered by that mandate? I think Director Reese, you did address the question as, are the vax reimbursement only for waiver providers?
Yes, the vaccine incentive was included in our Arpa plan, which was just for home and community-based services. So that did not include ICFs. So anyone for whom you're including in this plan must have worked must be billed under some waiver at some point in time during that period of time.
I have a question. Once you have submitted your proof of vaccination status to the DC Health dashboard, will the system generate some type of confirmation that this was completed? That is a good question, and I have no idea at this time. So that is something that I have to find out from IT and the developers. Does it generate that? some kind of confirmation pop up. I'm quite sure that your name doesn't come up in the system, but I will double check with that question. So exemptions from DC Health are the only valid documentation a provider can utilize. Will the staff/consultant be provided confirmation of the exemption that they can submit to the provider? Let me be clear with this. And DC Health has its own regulations on healthcare occupation that mandate a vaccination. However, a provider may say, we have our own requirements that are more stringent than DC Health. They may be able to do so under the regulations. A provider may say, we don't have the same exemption review, or they may say, in order to be employed here, this is our process. This is what we require. DC Health is regulating at this time someone's license or ability to practice in the healthcare profession under certain requirements. Similar to, you have to have a certain background check before you are in the healthcare profession. But an individual provider may have more stringent requirements. So if an individual provider has made the decision that DC Health's waiver process is sufficient for theirs, they have to indicate so. I cannot speak on what an individual provider's requirements are. So it is not accurate for me to state that the exemptions from DC Health are the only valid documentation a provider can utilize. That is not correct. Will the staff consultant be provided confirmation of the exemption they can submit to the provider? That was a question earlier, and typically, my understanding is if you were granted a exemption from DC Health under these regulations, you will receive a letter granting your request to be exempt from the regulations. So it would be a letter that you would receive. I think the earlier question was confirmation that you actually submitted proof of your vaccination status to the DC Health Board. I'm not sure about would you receive confirmation of that submission, but I do know if you're, whatever the decision is for your exemption, you will receive a letter from DC Health letting you know whether it was granted or denied. Would you receive documentation indicating their request of review? I'm 90% sure that you will receive documentation stating that we have received your request for an exemption. It is under review, but I would confirm that shortly after this meeting.
And what I'd like to if I could just clarify sort of two tracks here. One is the regulation really established an individual mandate. For people who are licensed professionals, I think it's very clear. To keep your license with the District of Columbia, you have to demonstrate that you have been vaccinated. And there's a date by which you must be fully vaccinated. But before you can renew a license, you've got to demonstrate you're fully vaccinated. That's pretty easy. Those of us who are licensed professionals are very much accustomed to submitting documentation, demonstrating that we've met the requirements to maintain our license for another, whatever the period of time is. For social work, it's 2 years. So that's on that side. Providers, so the way that the district went about imposing this requirement was to say that the requirement to be vaccinated will be included as a qualification for staff who have direct care responsibilities. And, there's some discussion because there's a difference in our sets of regulations about who is included there. But, for our biggest pool of people, it applies to DSPs, that to meet the qualifications, the staff have to be vaccinated against COVID. In terms of monitoring that. We'll monitor that at DDS for waiver providers, the same way that we monitor qualifications that are required for DSPs in other areas. So that, for example, when the provider certification review happens, they ask to see a certain number of personnel records. They examine those records to make sure that everyone meets the qualifications. And we'll be adding one qualification to that, which is vaccination against COVID-19. Unfortunately, as I said a couple weeks ago, Karen Stringfield isn't here. So I'm not sure exactly how it will work for the surveys that are done for our licensed placements, but I expect DC Health will look pretty much like ours does. So that's kind of the two tracks. I think that people are getting very hung up on all the specifics of how they get there, but I think kind of bottom line, it's those two tracks.
Thank you, Andy. That is absolutely correct. I think you clarified it very well. That it is a requirement of their licensure. But I think people have to understand that, and Andy, I need you to help me out with this one too, that while we have, meaning DC Health has certain requirements, the provider may have more stringent requirements in their individual capacity. And that's what I think sometimes people are conflating what the provider's requirements are to be employed with them and compliance with the law, as opposed to DC Health's requirements to operate in a licensed or unlicensed capacity when you have a health occupation position that has been specified in the regulation. So I think.
And for any of your professional staff, anyone can go. It's a public record whether they have a current license. So, we would check that as part of our reviews, but you can check that for any of your staff because, if they run afoul of the licensing requirements, which includes this vaccination, you'll note that in the public record.
The other, I think I had this question. So I do note that I would get information from Dr. Lewis about what kind of confirmation do you receive, whether or not you submit your vaccination proof or you requested a waiver. What kind of response do you have from the initial dashboard? Do you get confirmation submitted complete or a waiver request received, pending review, that kind of information? I will get confirmation on what do you actually receive. I'm going to let Andy handle 21, but I do have a question. So from experience, okay. Okay, someone said they have already submitted their documentation and they have not received an email confirmation that it has been submitted. I will find out if that was a glitch or is that expected. I think, Dr. Reese, you can answer this question about the rollout, but I will go.
Actually, I can't, but there's someone here who can. Donald, you're with us.
Okay.
So there's a question here regarding Station MD. Sorry that we're changing the subject here. Can you discuss the rollout and implementation of Station MD? And I thought Donald was with us.
I am Director Reese. I'm here. Good afternoon, everyone. Yes, we are happy to welcome Station MD to the district. Very soon, our provider network will be receiving emails pertaining on the next steps to support people with enrolling in Station MD. Overall, and from a high level, I'll explain the rollout. We're doing this in a 3-phase process, rolling out Station MD. The population that we're rolling Station MD out to is people supported in RESHAB, ICF.
Excuse me, Donald?
Yes.
Start with what Station MD is. Sorry, go ahead.
Oh, well, I don't want to steal too much of their thunder. They will be here next Friday to present and explain what Station MD is. But Station MD is really unique in its own right. It's a telehealth service that focuses on supporting people with intellectual and developmental disabilities. It is led by two former ER physicians who have vast experience in supporting people with intellectual and developmental disabilities. They offer, through telehealth, urgent care services. This is very much a tool to help with determining if a person needs to go to the hospital for hospitalization, and or if there are other solutions to prevent hospitalization. Other matters such as if a person requires a prescription, they can do an assessment via virtual telehealth portal and put in place the physician's order for a person as well.
Just to be clear, it's a telehealth urgent care provider, so it's not
Yes.
going to be routine health care for anyone. They provide urgent care.
Yes, this is very much urgent care for those situations. I think we often face in the service delivery system where people go to the hospital for mundane things and they sit in the hospital for a very long time, and it could have been taken care of via, telehealth services as well. So we're really excited to work with them. We are developing the project plan for rollout. It will be in 3 phases for people in rehab, ICF, supported living, and host home settings. You will actually hear more, and they'll give you a walkthrough of the Station MD experience from the user end next Friday.
And just to say, there have been just a handful of states that have used Station MD. They've seen a significant impact on emergency inpatient hospitalization and emergency room utilization. We are hoping to see that same impact, but that is also part of the rollout, is that we're going to be watching the data as we go to see that we have the same effective response here in the district that they've seen in other places. And as Donald said, folks from Station MD will be here next week, and they will also be at our provider leadership meeting next Thursday. So more on that very soon. Let me make sure I'm not jumping over things because I'm sure that I have already. So we have parents in natural homes that do not want to get the vaccine for them or their child due to the religion or other reasons, including medical, and also they are the in-home support staff for their child. They obviously live with their kids. How should the provider approach this? What documentation is needed? What advice? If they're being paid by Medicaid, it would be the same rule. So because they're then a provider and they would have to make that choice. Now, if you're saying here that there is a religious reason within your agency, I mean, any religious exemption, if this is someone who is classified as a Medicaid provider in this instance, then they have to meet those requirements. And so, they would have to meet the requirement for the religious exemption. We in the district government, we have the form that we have people fill out, but it's the same religious exemption form that we've always had that's been available through human resources for people who request a religious exemption for any other requirement that the district government has. And those occur. People may recall historically sort of firefighters and facial hair because of equipment they needed to wear. And there were discussions about whether it was okay for people for religious reasons to grow a beard when they had to be able to put things on their face. Issues around people's hair. So there is a religious exemption form that we have, and we would expect that agencies within their human resources would be able to have that same kind of thing. The next question is for our other folks, our policy people at DC Health. If a fully vaccinated person supported is exposed to someone with COVID, are they allowed to follow the guidance for quarantine for fully vaccinated individuals, meaning that they should be tested immediately upon learning of the exposure and tested again 5 to 7 days later, as opposed to entering a 14-day quarantine? Is it setting specific? That is, supported living sites have different requirements than residential habilitation sites. Nelson, I think you're here, right?
Yep, I'm here. I thought I was going to get out of this question because I thought we forgot about it. But actually, I'm sure that this is coming from some of the CDC update and language that does state this. At this time, however, DC Health is not going to be changing the quarantine requirement for those settings, meaning that in healthcare facilities, congregate settings, residents and patients, including correction and detentions, homeless shelters, intermediate care facilities, community residence facilities, and supported living must adhere to 14 days of quarantine. That being said, if you are in a setting or that is not licensed or that uses community guidance or follows community guidance, meaning it doesn't have setting-specific guidance that's been issued by DC Health, they would be allowed to follow that option. So I hope that clarifies.
Yeah, because
Sure.
I was going to say, what I have found is every time there's a question, please do go back to coronavirus.dc.gov and look at the health guidance, because as we all know now, with the changing circumstances, the guidance does get changed. Anytime it has been changed, we try to give an overview, but it's always helpful to remind yourself of exactly what it says. And those answers are all in that guidance on the website.
And that question is something that we're continuing to evaluate, but in our higher risk setting, congregate settings and things like that, given community spread as well as some of our breakthrough cases and those that are fully vaccinated, we at DC Health are going to continue that 14-day recommendation at this time, but we're continuing to reevaluate all of those things that I stated, and if that changes, the guidance will be updated.
And while we have you, were you going to answer this one and read the
I was
one
going to
about
answer
face shields?
about eye protection. And so this is something that has come up several times, and I think I'm going to answer this in two ways. What I'm going to tell you is right now what's currently posted is what should be followed, and it states that eye protection is still required. And for transmission-based precautions and standard precautions, also when there might be splashes and sprays and things like that, but also when caring for someone who has suspected COVID or confirmed COVID, is what it says right now. What I can tell you is that you will see, I hope within the next week, an update to that guidance that brings it really in line with CDC's recommendation that during substantial or high levels of community spread, that eye protection should still be worn, rather universal eye protection. So some of that language that you saw before that said, eye protection must be worn when within 6 feet of a patient while indoors, while DC is in phase 2, some of that language has changed now to take out the phase language and introduce some of the community spread language. So you can anticipate that guidance. I'm not going to answer any questions specific to it until it's posted, but once it's posted, if you have questions, then I'll be happy to answer it.
And based on what I'm reading here, we will make sure that our quality resource specialists are provided the current guidance as well as that updated guidance once posted. Because it's hard to tell from this whether they observe someone, what the exact circumstances of the person not having a face shield on were. With reference to what Nelson just said regarding quarantine, if vaccinated people have been exposed, then test negative, they no longer have to remain in quarantine. Is that correct?
No, that's not correct. Negative test does not reduce or eliminate quarantine in that instance or this population.
Oh, wow. I just looked down at the clock and it's already 1 o'clock. I can read one last question here because I actually have a cluster meeting with the other directors in our cluster right now. So the concern is that even though providers can put in more stringent requirements to have their staff submit exemption forms and receipt of approval, the responses don't go directly to the provider. So the provider will be in the dark, and there's such a shortage of DSPs right now that providers cannot afford to lose any to operational delays or DC health implementation. So I just want to say a couple things about this. One, the provider as an employer can put these requirements in and say, you have to meet my requirements, first of all. So is it true that the individual has to submit a request for an exemption to DC health? Yes. Can the provider say you've got to meet it here? Yes. So, like I say, it's kind of parallel tracks, but they are two separate questions. There is a concern, certainly, we're all aware of it, of the DSP workforce. And it's especially a concern when I look at some providers who are at 25 and 30% of their staff vaccinated. It's a huge concern. But I don't think that operational delays or DC health implementation affect that at all. People need to get a vaccination and then continue working. And to the extent they are requesting an exemption, as long as they've submitted the request timely, they'll be fine, is what I heard today. Other than that, as many of us as possible, because as I say, I recognize that there may be some small percentage of people with health reasons that prevent them from getting vaccinated, or real religious concerns that cause them from having objections to all vaccinations. I'm not aware of any religions that have specific concerns about a COVID vaccination, but a real religious concern about taking a vaccination. Other than that, we ought to have everyone vaccinated. It's the only way that we're really going to move past this. So this was a rather quick hour today. I'm sorry, it feels like I'm cutting off abruptly, but that is where we are. I have to move on. So I hope that we've answered your questions as well as we could at this point in time. And we will talk again next week. Thank you.